Hi, I'm Dr. David Warwick, your local Lacey, Olympia chiropractor. I'm going to be working on Carol, and I'll only use first names. She wanted me to work on everything, so you get to see an everything adjustment and treatment today for relief. It's been a while since she's been in. My patients come in when they need to. They're not in long-term care programs, provided they haven't had any substantial injuries, such as an on-the-job injury or a motor vehicle collision or some type of other injury. All right, Carol, we're going to start out with a little bit of traction here in the lower back. Right here, left side. Okay. So I do a nice little traction to loosen her up just a little bit so the adjustment goes easier on her. Increase the height on the table. This is too much, let me know, I'll back it off, yeah. Good so far? The traction ends up creating nutrients and movement for the lower back in there. When we do a lot of sitting, as our jobs can be, or we're in front of a computer, or we're behind the wheel with a longer commute. Worst thing for the spine is a sitting position in our body. So the chiropractors address this area more commonly in the pelvis, sacrum, L4, L5, most common areas. That's where we'll see get a lot of our tension, herniations, low back pain right there, and then the pain and problems start to distribute down from there. So it starts out typically as like an episode or just a little bit of low back tension, and eventually I describe it like a cavity in the tooth. You know, it's not a big deal to see the cavity on the outer surface of the tooth, but if you don't change your eating habits and health care overall of your body, what you put in your mouth, in your body, that cavity is going to get worse. And eventually you could end up at the endodontist where they have to do the double root canal. So the chiropractor ends up looking at and seeing where things are at and the health of the overall spine. And first we look at the posture, then we check for movement and motion into the spine. Now Carol did have, you did have low back surgery, correct?
Yes.
Yeah. What did they actually do?
L4, L5.
And you still have low back pain even after?
Yes.
It wasn't fused though, was it?
No.
What, discectomy?
Yes.
So my hand's going to be right here.
Okay.
We're going to move it side to side. I'll try not to pinch you. You can just rest your arm against mine. It's fine. Too much?
Nope.
I'm going to go real slow with her because it's been a little bit since her last adjustment. When did I see you last? About 6 months ago?
Yeah.
Yeah, I think I'm a few hairs shorter since then. You know, a little more gray added.
Me too.
It's called life. So then I just let the patient stay on the side here so we can get a nice traction. You okay? No flare up?
No.
On the muscle over here called the QL, or quadratus lumborum. And there are some precautions you want to take depending on the surgery. You know, I know the history of her already and have worked with her in the past, so you know, you find out the individual's tolerances and work toward that. Nice traction on the SI joints. Okay, so in Carol's situation, she had a ankle injury as well. So you see accumulation of things that we work with. So her left leg tends to be shorter. They actually did surgery on the ankle. That was work related too, wasn't it?
Yeah.
Yeah, those people who work out on the docks out there, big shipping areas. Okay, so I'm going to press your test. That joint there, both legs are even. We're going to adjust the left SI joint right on the pelvis here. Okay, both legs are even. And the knee even released as soon as I made that change. You okay?
Yeah, it's just the right knee.
It was the right one?
Mm-hmm.
This was the one that released though, didn't it?
Yeah. Mm-hmm.
Okay. Let's do this. Go ahead, raise this leg for me. And down. Try the other one. Back down. Now you didn't have the surgery on the right knee, did you?
Yeah. Meniscus. I'm just.
And it's still, did you do the physical therapy portion of it?
Yeah, it still
quite
doesn't want to
bad.
bend all the way. It hasn't been hurting like it used to, but
It was torn.
yeah.
How bad?
Not too bad. Just enough to make it.
They cleaned it up though?
Yeah.
Yeah, I mean, if something's torn in there, chiropractic's not going to be able to adjust tearing. Okay, I'll go real easy with you. All right, go ahead and raise one leg for me. Back down. Try the other one. Back down. So when people have, or like in Carol's situation, you have surgery here, surgery here, surgery here, you're getting the body overall to move better, feel better, get in better alignment, get her out of pain as quickly as possible. Okay. So I spent a lot of time, both SI joints. Let's have you put your right hand on the lower back. So the right leg pulled up shorter with that movement. Hand down. We have L5, right side. So I'm on the outer portion. A little tender there.
A little.
Left hand lower back. No change in leg length. So these are, yeah, I felt that. I won't go up as much. Both hands on the lower back. Back down. And you can see when people have these kind of things, you have to modify your treatments because I use the leg length and bending of the knees at the initial, but I can't be doing that throughout her whole spine. That's just going to irritate this in there. So you want to be as careful as you can. Take a big breath and release it. Breath in for me, and good. Yeah, tougher area in here. I think I'm going to adjust you face up. So I'm going to have you lay on your back for me, please. Good?
Yep.
And for this adjustment, I want you to bring your feet on the table, knees bent. Good. We're going to cross the arms like this. By doing that, takes our tension out of the lower back, and we're, wow. Breath in, blow out. Breath in again, and out. You doing all right?
Yep.
I'm going to be in your viewing way here. And you're okay with the manual adjustment?
Yeah.
Okay. So right at 4, C4 and 5. There we go. And there's many different ways to adjust cervical spine. This is just one of the ways that she prefers. You can use the instrument, you can do some traction. You can even do it where I do with pressure with the fingertips on the actual misalignments right here. We're doing traction with circle area or the neck. Raise your head and back down. Good. Just a nice gentle pull. If it's too much, let me know. I think I have an earring caught there. Sorry about that. Good. And legs down for me. This is the surgery one, correct?
Mhm.
I'll go very gentle and easy here. Table will drop underneath. Good. So I'm just doing a straight movement into her knee area. Gentle drop in through there. That's what it, so it produces like a recoil in there. It gives her a little better range of motion. Let's have you go face down for me again. It'd be easier to put you on a rotisserie, wouldn't it? Can you bend your right knee for me? Back down. Okay. Okay, so I'm checking the knees now on her. I'm pressure testing the joints. Using the instrument to adjust that area. Even after surgery, there's areas that you can adjust. You just have to know a little bit about the history of it. Was it the right meniscus or left meniscus on that?
Right.
Okay. Just a very gentle traction in through there. Good. Okay, now try bending that knee again. Was that easier?
Mm-hmm.
Okay. And we're just going to help reduce tension on the hamstrings. So Carol got a little bit of extra TLC today.
Yay.
All right. Anything you want to say to the camera about your treatment?
Awesome job.
Thank you.